Step 2 is where you have your cosmetic surgery project directly sabotaged. And you can fix this nostril.
I want to experience the secondary or tertiary rhinoplasty.
You realise that you've basically been dumped by the patient coordinator. And the weather is spoiling us here in Besiktas, Istanbul. I'm just so lucky. I don't want it to stop. Now, that wasn't the only time that it snowed during my many weeks in Besiktas in Istanbul in early 2022, but it was the one time that it impacted my project schedule, as you are about to learn. So anyway, as to step 1, to get a head start with this mission, coming to Istanbul for 3 weeks in order to both undergo and recover from your long-planned cosmetic surgery makeover, getting absolutely nowhere with it, and realising that coming straight back home is actually not the most prudent step to take. It's vital that your planned fertility project transforms instead into a cyst removal and skin tag removal project, and that pushes your cosmetic surgery back by no less than a fortnight. I'm just doing a little film of the place where I'm having my first gynecological appointment. It's an American hospital. Here I am, and yeah, just waiting to see the professor. Now, I can't guarantee that you will get the same non-outcome from American Aesthetic, a well-known cosmetic surgery hospital in Istanbul, that I did. You can certainly give it a go though. More on that in a bit. Right now, I've got an operation to prepare for. I've just had an examination. I've had to take all my top clothing off and put this garment on, and I'll show you the machine that I was tested with. This is the machine that I was tested with. I had to go to it and basically hug it, and I had to take a deep breath and hold it. Yeah, I had to take all my top garment off. I'm now getting dressed, and I have to go and provide a sample. You never guess what this is for. So, a few hours ago I had my gynecological surgery. It all went really well. I was under a general anaesthetic, but I'm totally fine, so I can go home now. I don't have to stay the night. I'm grateful and I'm happy. I was equally happy and grateful to know Sarah, the delightful young interpreter at Birinci Hospital. That's a hospital completely separate to the one where I had my surgery. That one was Med Hospital. Sarah is efficient, articulate and lively. She is fluent in Romanian, Turkish and English, and has no idea how. Also, for my post-surgery meal at that hospital, I got chicken and rice, and it was delicious. The appearance of my genitalia, I won't comment on, but I can tell you that I am glad that I had the surgery that I had at Birinci Hospital with the lovely Dr. Gökhan. Hemorrhoid removal was something that I hadn't consented to before my surgery at Med Hospital a few days before. But it turns out that the bubble of pink sitting on my perineum was just empty skin. As such, 74-year-old Professor Texan, the founder of Med Hospital, actually did have my consent to remove it, since the surgery that he performed on me was to remove my ovarian cyst along with the skin tag on my vulva, the bubble of pink on my perineum being not in fact a hemorrhoid, but simply a part of my skin tag. I was too old for cortical tissue freezing. I was too bored for egg freezing. Dr. Gökhan at Birinci Hospital got rid of the remainder of my skin tag because Dr. Benjamin, a general surgeon at Med, who I think is also a professor, who said I should just forget about that bit of skin since that sort of thing is as common as it is harmless, just wasn't interested in removing it, not even for the £1,500 that would have earned Med. Mind you, my surgery at Birinci Hospital was only £800. So anyway, with my necessary recovery time, the second surgery on my genitalia extended my gynecological treatment by a fortnight. The post-surgery meal that I got at Med was a nasty little soup, and I couldn't get to KFC fast enough. And that, lovely viewer, was step 1. In case you don't know, I'm Gina and I'm from London. Now, step 2 is where you have your cosmetic surgery project with the surgeon that you have come to Istanbul to have your surgery with directly sabotaged. And this same sabotage is guaranteed to add another fortnight to your trip as a minimum. With the scope and the thoroughness of your consultation with your cosmetic surgeon, who may well be Professor Bayram from American Aesthetic, your consultation lasts all of an hour and a half.
Can I see?
Yeah, the thing is, I'm on my period and I've got, like, you know, equipment down there. See, this is what I want, Professor. I want this. So instead of just that, I want. And especially on this side, can you see this side?
Özellikle diğer taraf diyor hocam. Your scar for previous surgery, it was like G, a G letter. But he wants to take excess skins from here as well, and he needs to do it in shape of T. After surgery, he can advise you silicone tapes that he is going to show you. It really helps for better healing.
You then spend nearly a week waiting for A, a full list of all the procedures that the surgeon has suggested, B, the corresponding prices, and C, a suggested sequence of surgery. You were promised all of those things during your consultation. Now, soon after, you start to worry. To be exact, when the patient coordinator finally replies to the message that you sent him, nudging him to send you your surgery particulars, it looks like your cosmetic surgery project is back on track. The last thing you want. Luckily, before long, you find the patient coordinator once again going out of contact. Finally, you realise that you've basically been dumped by the patient coordinator, and you accordingly breathe a huge sigh of relief. Your cosmetic surgery mission seems well and truly doomed. And that was step 2. Hi friends, does anyone want to play Guess the Month here in Istanbul, Turkey? I'll give you a clue, it's March 2022. I'll say no more. Bye! Now, for step 3, in a mood of total confidence, you then embark on a notably hectic cosmetic surgery consultation circuit. You are confident that your meetings with other cosmetic surgeons will prove, similarly, to be a complete waste of time. This clearly means that, where your cosmetic surgery plans are duly concerned, you are bound to return home empty-handed. Now, he only has a handful of reviews on realself.com at the time that I'm recording this video, but Professor Nazim Shirkesh is no less a world-famous rhinoplasty specialist, a rhinoplasty being a nose job, and with the complexities presented by your nose as a result of your 2 previous nose jobs, you are not missing out on a chance of surgery with the rhinoplasty king.
Tip doesn't have the definition. Tip defining points are not does not exist. And this, as you said, this is too high for your ethnicity. And this is moving actually pretty broad.
Or perhaps you are. In fact, you definitely are going to miss out on a chance with having your nose done by Professor Nazim Shirkesh, because he's not available for months. Dr. Akin Inaloz from Aesthetic International is prepared to do your breast augmentation with lift, your arm lift combined with liposuction, and to perform jawline liposuction and to tighten your platysma. The thing is though, at this point you want someone who, in your first round of surgery, will do your upper blepharoplasty, eyelid lift, and your revision rhinoplasty along with your jawline and your neck enhancements. And you can fix this nostril.
Yes, but very difficult operation.
And okay, what about the tip? You see, the bridge of my nose, I think, should be longer. I think
Short nose.
yeah,
Short.
exactly, because the tip.
And angle is too much. Uzatılması gerekiyor.
Yes.
Evet.
Yeah,
We should make it longer.
yeah, but not so long, just a little bit.
Yes.
Of course. Yes.
That's something you can do.
I don't to experience the secondary or tertiary rhinoplasty, but Dr. Cenk is very experienced.
Okay, and that is the end of Dr. Akin Inaloz. which means that your cosmetic surgery mission is once again successfully thwarted. Now, you accept it when Dr. Arda from Miaplast, Dr. Arda being a plastic and reconstructive surgeon, tells you that your nose job has to be done as a solo procedure. It can't be combined with any other procedure as it will take hours. You are no less tempted to accept his offer of a facelift, a chin enhancement and upper blepharoplasty as a start, and you are pleasantly surprised by the price. At no point were you expecting to get so much surgery for as little as €6,000.
She wants a face and neck lift surgery. She had already one before, and also we can improve the result with taking the skin and the underside, the platysma, like this. She had already a chin implant, but we can improve the chin with the fillers or fat injection. And these are the
And my eyelids.
eyelids, and we can also do an upper eyelid blepharoplasty. And also she needs to reduce her forehead with hair transplantation, hair restoration surgery.
Only your Dr. Arda does a Professor Nazim Sherkesh and turns out not to be available for months. Another cosmetic surgery mission dodge. Your consultation at Ashley Tarkan Clinic is eye-opening, thorough and quite good fun.
First of all, this is going to be a revision operation. For this, we are not using silicone or something, we are using rib cartilage. This is okay, but
Only
here,
this.
no.
So no jaw implant, just chin?
Yeah.
Yes, chin implant.
Oh, okay, well, but why not a jaw implant?
Neden?
Take duruyor.
It looks fake.
Oh, okay.
Already here is good.
No need.
It's better to do not touching.
Yes.
Oh!
Already it's big.
Yeah, that's because I have filler.
Yes.
But the last time I had filler was a year ago.
But still, okay.
Okay, all right.
Yes, it came down.
Yeah.
You had lifting before, reduction as before.
Yeah.
And first of all, not lifting, you need to feel here.
At Ashley Tarkan Clinic, though, it will take too long to have a consultation with each of the 3 cosmetic surgeons who are due to take part in your surgery because they're not available for weeks and weeks. And regarding surgeon availability, you're starting to see something of a pattern emerging here in Istanbul. And anyway, that spells the end of your dealings with Ashley Tarkan Clinic. After that, you go to Dr. Zafer Atakan, a VIP cosmetic surgeon from Jinamed with no fewer than 36 years of experience. After your lengthy consultation with him, you feel as if you've just met your cosmetic surgery fairy godmother. Mind you, that's more or less how you felt after your consultation with Professor Bayram from American Aesthetic. But anyway, you see, Dr. Zafer is willing to offer you all your desired face and body surgery, face in one session, body in another, and he offers you an important education in the matter of how frequently a person can undergo a general anaesthetic. So how many general anaesthetics can I have in any time frame? Is it every 6 weeks, every 3 months? Since I've been in Istanbul, I've had 2 general anaesthetics. I had 2 in 15 days.
Darling, you can take 2 general anesthesias in 1 week also, or 2 days also. It depending on your health conditions and the blood tests.
Okay. You feel, though, that you need to do more research on your doctor's affair before you commit to having your cosmetic surgery makeover with him. You also now want your revision rhinoplasty to be performed by a rhinoplasty specialist only, and you're prepared to have it done as a single standalone procedure if necessary, and above all, you want that done first. That if you can trace a reputable rhinoplasty specialist with availability this side of 2096. Dr. Gökhan Temiz from Polyclinic hardly offers you any surgery. Clinic Hub, meanwhile, just forget about you. Thank goodness, right? Now, that was step 3, and it really is time to say congratulations. Your cosmetic surgery consultation circuit, which has turned out to be completely fruitless, has cost you another 2 weeks. Hey, congratulations. Snow is just so beautiful. Really makes the place just look lovely, all dressed in white. Now, step 4 involves you having your planned orthopaedic treatment sabotaged. For adding weeks and weeks to your stay, this really is just the ticket. To be exact, for causing a further substantial and planned extension to your time in Istanbul. Your insultingly mismanaged orthopaedic treatment surpasses even your ballsed-up cosmetic surgery mission. Pay close attention to the following steps. Have a consultation with Dr. Mehmet Erdem after organising it with Clinic Hub. Hi guys, presenting the wonderful Dr. Erdem, who's just had a look at my foot. I'll let him say a few words about what he thinks of my injury.
I think we will handle it, don't worry.
Okay, well that's what I like to hear. Thank you so much, bye. To handle your injury, Dr. Erdem needs an MRI scan as well as x-rays of your foot. Here I am at this place, just waiting to have my MRI done. It's just so clinical and clean, and anyway, let's see how I get on. How you got on was to have to wait about 4 or 5 hours to be seen, not to be able to get a taxi back afterwards, subsequently have to keep pestering the patient coordinators at Clinic Hub for updates on when your insole, which is what you turn out to need for the healing of your foot, will be ready, and then be told in the end that they aren't making you the insole after all. Orthopaedic surgeon Dr. Ozgur Mengesh from Jinemet Hospital, who you turn to after your failed attempt for treatment with Clinic Hub, prescribes ice and anti-inflammatory pills as well as an insole to enable your foot to heal.
You should use insole inside the shoes. Medication, and you should put ice where you have pain 4 or 5 times a day, 15 minutes approximately. And then 10 days later you should come back here again, I should check you, and then we will decide about the treatment.
So 10 days for the insole and the anti-inflammatory pills to work. If they don't, then you need a program of cortisol. And how long will you need to stay if you do actually need to go on the cortisol regime?
Generally, we do the cortisone injection between 7 to 15 days.
So there you are, bound to Istanbul for another 10 to 25 days, plus the 5 days that it's likely to take for the insole to be made. Potentially another 30 days total then. Fun times. Now at this point you've been in Istanbul for a whole month longer than you had planned, and your plan for a totally chaotic and disillusioning cosmetic surgery expedition couldn't be going better. And that was step 4. Here we are, lovely friends, another day in paradise, snow paradise, here in Beşiktaş, Istanbul. Bye! Now, while step 5 is unquestionably the least complicated of the 5 steps that I am presenting, it is by no means any less effective than the others. About 3 days after you get your insole, at long last. So, what are my instructions?
No English.
Okay, so...
Madam. 1 week
Yeah?
pain. Maybe.
Okay.
Okay? But good shoes, good feet. Okay?
You take the decision while you are in bed, say, to complete your orthopaedic treatment at home. The morning after, you wake up, you put on your dressing gown, you open your curtains, and you understand that what you are about to sit at your laptop to do isn't to go on Expedia.com to book a flight home. So, guess what hasn't happened overnight for the first time in about 4 days here in Beşiktaş, Istanbul? Yeah, you've guessed it. That was actually the first time in 5 days that we hadn't had any new snow. And it was just my luck that the first day of snow was the day that I had planned to book my ticket back to London. Yeah, I might have been okay on the road to the airport and then on the plane and back to London, but I was too scared to risk it because of the weather. So anyway, after seeing the weather on the morning in question, you don't actually have to sit down at your laptop at all for what you need to do next. You can just book your new stay at your hotel directly with reception. You just phone them from your room and you book it. And that, cherished viewer, is how to get stuck in Istanbul during your projected 3-week cosmetic surgery trip. If you've enjoyed this video, then I recommend you to watch this one next. I'll meet you there.